And good evening. I am Dr. Dan. Welcome to another episode of What the Health. Every week we go live with a new trending health topic where we go over the latest and greatest and tried and true health trends to help us to get healthy and stay healthy for a lifetime, hoping to learn to live in a salutogenic model. This week's episode, I'm talking about how it would be possible for me to support universal health care. Obviously, a huge topic right now in the next presidential debates that are coming up. Congressmen, state senators, billionaires talking about how we can make universal health care a possibility in our country. So I wanted to just take a minute and weigh in on that this evening on how I could actually support a universal healthcare system. So I am going to go ahead and jump right into that, talking about how I believe that we could societally, have a successful universal healthcare system. So let me start off by saying that I do wholeheartedly support universal healthcare. That's right. I do, in fact, believe that every single man, woman, and child should have access to a caring system that would give them the best fighting chance to get healthy and stay healthy for a lifetime. Now, I'm not really sure why anyone would resist such a system because it sounds so beautiful and idealistic. Oh, yeah, that's right. We have to figure out who the heck is paying for this. So, I would personally be happy to pay into a system that was caring and that allowed my family and supported my family to get healthy and stay healthy. However, there are some challenges that I foresee that must be actually addressed before we can implement them. The one big challenge is that a true healthcare system right now in our country does not exist. Right now, we have a disease management system. It does little to address the actual cause and cure of how to get healthy and stay healthy. And this is one of the problems that I see right now in the debates. Everyone is just talking about how can we give everyone access to our current healthcare system. The problem is that our current healthcare system is already in the process of bankrupting our nation. We pay nearly $10,000 per person, per man, woman, and child in our society every year, $10,000 per person per year into this system that is not helping us get healthy and stay healthy. It's managing the current diseases and managing them in a way that these diseases are becoming more prevalent and more frequent. And obviously, there's a lot of people that don't spend nearly that much. And on the flip side, there are people, and I have friends and family members, and I know that you do, that go through certain treatments, especially in the cancer realm, that cost in excess of millions of dollars a year to intervene in that disease process. So the next big concern then becomes, so how the heck, if we don't have a true model of healthcare, how the heck can we pay into a system if we did have a true model of healthcare? So we can look at that in two ways. The one is currency, and I, for one, certainly cannot afford to pay $40,000 per year out of pocket for my family of four. So the other way that we have to look at paying into this system is a level of conduct. How do we conduct ourselves in order to buy into this universal healthcare system? So we have to look at the day-to-day choices that we make, because the choices that we make have a lot more to do with our health and well-being than the actual genetics and genetic expression and the potential diseases that come about with that. So I am going to propose the following code of conduct to help us get healthy and stay healthy, because those who choose to abide by this code of conduct will be much less burdensome on our system and society as a whole. So they should have a way that if they are following these codes of conduct, that they should not have to pay as much into the system. So here we go. Whether you agree or not, this is the code of conduct that I am going to throw out there, that I believe that if you could not pay with currency into a universal healthcare system, you should be able to pay into this system by a code of conduct. So number one, we are going to practice 15 minutes of intense physical exercise once per week. That's it, once per week, intense physical exercise. But then on the other 6 days a week, you're going to do the equivalent of 10,000 steps, very light to moderate exercise, the equivalent of 10,000 steps per day. Okay. Number two, you're going to get 6 to 8 hours of sleep per night. Ideally, you get that between the hours of 10 p.m. and 6 a.m. Number three, you're going to consume less than 2 servings of added sugar or refined carbohydrates per week. Yes, unfortunately, that means you have to eliminate nearly all cookies, candy, ice cream, sweetened beverages, pastas, and breads. Number four, we are going to eliminate all alcohol and tobacco products. Number five, we are going to consume a minimum of 5 servings of vegetables daily. Number six, we are going to get some type of physical body care, such as a massage, acupuncture, seeing a chiropractor, minimally once per month. Interestingly enough, a study done in the early 2000s showed that people who considered their chiropractor as their primary health doctor, they utilized 85% less medications and were hospitalized 67% less compared to people who considered their medical doctor or a medical practice as their primary care. How about that for saving into a universal system? Number seven, we are going to participate in a spouse or partner, a friend, a professional or community activity minimally once per week. We are going to, for number 8, we are going to practice time-restricted eating, meaning that we're only going to eat 8 hours per day. So let's say, for example, between noon and 8 p.m. And then we're going to participate in a 5-day fast, meaning that liquids only, 5-day liquid only fast, once per quarter. Number 9, we are going to utilize vaccines or artificial immunizations that comply with EPA toxicity standards for heavy metal exposure. Hint, hint, those don't exist right now. And we are also going to eliminate the use of toxic makeups, creams, antiperspirants, and perfumes. And finally, number 10, we are going to obtain 15 minutes of sun exposure on the arms and legs and face per day. So, that was a lot. I know what you're thinking right now. Dr. Dan, that sounds nearly impossible to abide by. And I would agree that it is very difficult based on our current societal norms, that it is very difficult. However, there are thousands of people in our society that do choose to follow that code of conduct that I just read, probably within a 90% compliance rate. And those individuals have studied health relentlessly, and they have chosen to execute those practices into their life. And many of those individuals, unfortunately, suffered from our current failing sick care system and poor societal lifestyle choices, and they worked hard to overcome to keep their health there once they recovered it. Now, I would go far to say that if someone is not following the entire above code, it's not completely their fault. What do I mean by that? It is true that there are massive addictions to nicotine, alcohol, sugar, and electronics, and those addictions begin at such an early age before we even have time to understand the detrimental effects. And I can appreciate living in a climate that is not conducive to sun exposure for large periods throughout the year. And I certainly can appreciate the misinformation surrounding toxins in foods, medicines, heavy metals, and beauty products. And exposure to abuse can lead to difficulty forming new and meaningful relationships. Socioeconomic locations may not be conducive to have access to healthy food options. Much of this is outside of our sphere of influence when we are exposed to these patterns in our early formative years. However, If we truly want a universal healthcare system, we must take responsibility for the conduct that is truly within our sphere of influence and do everything we can to live according to health creation habits. Otherwise, if we are like the congressmen and women and the presidential candidates and people who are screaming for access to a current failing system, if that's the only thing we're asking is that we just have access to a current failing system, we will bankrupt our nation. It is not a matter of if, it is only a question of when. So yes, I do support universal health care, but only in a complete restructured model that supports health and does not solely focus on disease management. I also support universal health care when the system places the majority of responsibility on the individuals in both the currency and what they're investing in, and more importantly, their conduct. The only major obstacle I see with everything that I mentioned above is that there are companies in the food, the pharmaceutical, the medical, and beauty industries that would lose hundreds of billions of dollars if and when we ever decide to implement this type of true universal health care. Therefore, due to the massive lobbying power of those companies and my belief that we do in fact get to pursue our own happiness, even if that involves having a scotch and a cigar, a cookie and a candy, and even if that happiness is to the detriment of our own health, I do not foresee any massive change that can or should be happening at the national level anytime soon. However, you do have the responsibility and the opportunity to change the direction of your health right now by abiding by some or all of the conduct that I did just mention. And that is enough hope for healing in my book. I am Dr. Dan with another episode of What the Health. We will see you next week. Here's me saluting your salutogenic health.